So oncology, as we know, is very concerned about curing the disease and ensuring survival of the patient. But that's not the whole story. The modern oncology, when I treat a breast cancer patient, she still has 20, 30, 40 years to live. What are those 20, 30 years going to look like? What is going to be her quality of life after this treatment? That's a big passion for all of us. And particularly for me, that is one of the biggest things that I keep looking at. So, for example, in head and neck cancer, which is one of the commonest cancers in India, once I've removed the jaw because it had cancer, will he or she be able to eat? And for that, we are doing a lot of things. We are not just replacing this bone with another bone, we are also replacing the tissue which is there inside. And also, we are trying to ensure to do the surgery in such a way that there are no scars over the face. So, we try and avoid scars, we replace like with like, and we try to reform the phase as much as possible. In this, one of the things that we pioneered in Chhattisgarh was use of 3D printing technology in reshaping the jawbone with millimetric precision, so that this side and this side are totally identical to the millimeter, and that is something that we are very proud of. And this we are doing routinely for our patients, and this gives excellent results. Sometimes they go back with an appearance better than they had before surgery, and better than they had before cancer. Another thing is, like in breast cancer patients, for the majority of our patients, we don't need to remove the entire breast. Just removing the lump and removing the nodes in the axilla is good enough. Sometimes even removing the nodes under the underarms is not exactly needed, because we don't think that there's a lot of probability of cancer being there. So we just remove few nodes selectively, and that prevents a lot of complications that can happen in a breast cancer patient long after surgery. So doing the minimum, trying to reconstruct as much as possible, and trying to access in a way which doesn't disrupt the entire body. So in a breast cancer patient, we try to take an incision in such a way that it won't be visible. In an abdominal cancer patient, we try to go with a minimal access procedure such as laparoscopy, so that we don't make a huge large incision and prevent the complications that happen because of those kinds of incisions. Uh, Finally, we reconstruct. So, like I say, in the jawbone, we reconstruct bone with bone. In breast cancer patients, we use tissue from around the breast, or we sometimes use tissue from abdominal wall, some excess fat from abdominal wall, which we use to reconstruct. And we try to give a symmetrical and an aesthetic appearance to all our patients, in addition to trying to cure that patient, the cancer. So let's be very clear. Curing the cancer is not negotiable. If any of these aesthetic things, any of these cosmetic things affect the cure of the cancer, we will not do that. Cure of the cancer being assured, we try to do all the other things that ensure a good quality of life.